Excellent. We're going to go ahead and get started. Thank you, everyone. We're so excited you have joined us today for our second Candidates Forum for Alameda County Board of Supervisors, District 3. My name is Euphemia Tesfaye, Policy Director at Alameda Health Consortium, and I'm so pleased that we have our top two candidates for District 3, Rebecca Kaplan and Lena Tam, who are both here with us today for this important conversation with our health centers and our community members. I want to take a moment to share with you the agenda for today. We'll start out with an overview, followed by a moderated discussion with the candidates. And we've also carved out some time for you to ask some questions. And we'll conclude by sharing with you important voter registration dates. The Alameda Health Consortium is a regional association of 8 federally qualified health centers that serve over 95 clinic sites collectively and reaching more than 340,000 patients. AHC advocates for high quality healthcare for the underserved in the East Bay and collaborates as a thought partner with policymakers to inform, shape, and implement health policy changes. With our members, we organize civic engagement efforts like today to activate our health center staff, to also participate in voting and advocacy efforts. Born out of the civil rights and social movements of the 1960s, community health centers and migrant health centers were established in response to address the growing healthcare disparities in our marginalized communities, resulting from a core belief that access to healthcare, accessible, high-quality healthcare, should be provided with respect and dignity, regardless who walks through our doors, regardless of their insurance status, income, race, ethnicity, as well as immigration status. Now, I want to introduce our moderator, Andy Martinez Patterson, CEO of Alameda Health Consortium and Community Health Center Network. Before coming to AHC and CHCN, Andy worked at the California Primary Association for nearly 15 years, where she worked to advance the mission of community health centers. For the last decade, she worked to build and advance a payment reform initiative for health centers in California. Andy's background includes public policy, community organizing, advocacy, and member engagement. Before I hand it over to Andy, I want to remind you that you can use the chat box to send in your questions. And then, of course, we're going to have a dedicated time where you'll be able to engage with our candidates. Andy, I'll hand it over to you.
Thank you, Euphemia. I'm so pleased that I can be here this afternoon and stand as moderator for our nonpartisan candidates forum for Alameda County Board of Supervisors, District 3. This is an important opportunity for constituents, our health center staff, our community members alike to get to know our two candidates and ask questions about their priorities, their vision for the district, and how they hope to implement positive change. Today, candidates will have time to introduce themselves and answer some questions that we've pre-scripted, as well as some questions from you, the audience. Before we get started, I would like to share a few ground rules. This is a safe space, and while we encourage all questions, it's important to note that disrespect and uncivil remarks and or questions will not be tolerated. While each candidate will have the chance to answer your questions, there will be no time for rebuttals because we only have a short amount of time today. Each candidate will have 2 minutes to respond per question, and at the end, each will have 1 minute for a closing statement. We will start with giving them each the floor to talk about their priorities, telling us about themselves and their inspiration for running for Alameda County Board of Supervisors District 3. So we'll go ahead and get it started. And we are joined by Rebecca Kaplan and Lena Tam. And I'm going to start, Rebecca, with you, if that's okay. Please tell us a little bit about yourself and what motivated you to run for Alameda County Board of Supervisors District 3. And then, Lena, we will turn it over to you.
Thank you so much. And just to make sure I'm abiding by your time, who should I be looking at for time signal?
What do you think, Euphemia?
Yes, sorry, I was on mute. We'll have somebody G-chat you.
All right. All right. Well, good afternoon, everyone, and thank you so much for getting us all together again to talk about this incredibly important opportunity to build a stronger and healthier future for Alameda County. My name is Rebecca Kaplan. I currently serve as the Oakland Council Member at Large and Vice Mayor. I also represent all of Alameda County on the Alameda County Transportation Commission and the Coliseum Authority Board. It's wonderful to be with you all again, as fighting for community health with justice has been something I have been dedicated to throughout my life. And I see this conversation as an ongoing one and would seek to work with you should I have the incredible honor to be chosen Alameda County Supervisor. In terms of my own history and how I come to this work, I was an activist from a young age, was raised in a household about respecting justice and workers and fighting for equity. In the 1980s, as a teenager, as one of the only openly LGBT teenagers that I knew, I got involved also in AIDS activism. And so from a very early age, I saw the intertwinement of bad health and injustice and of prejudice from the federal level and mass death. And that was something that I was politically active on from my earliest formative years. Being involved in politics was fighting for treatment for AIDS patients and for that to be taken seriously. I volunteered on the campaign of Senator Kennedy of Massachusetts, somebody who fought very hard for healthcare, and got involved in the idea of electoral politics being one of the ways that we could make change and improve the lives of people in our community. I attended Stanford Law School and then worked in Oakland as an attorney on worker rights and housing rights cases, and was elected to the board of AC Transit, where I helped advance discount passes for seniors and people with disabilities and youth, and clean fuel technology to clean up our air. Since being elected to the Oakland City Council, I've helped advance programs like the Civilian Crisis Responders, known as MACRO, and brought in tens of millions of dollars of state funds for core community needs. I'd be honored to be your supervisor. Thank you.
Good afternoon, and thank you for hosting this forum. I am Lena Tam. I had served on the Alameda City Council as the first Asian woman vice mayor, and I'm running for the County Board of Supervisors following the tragic passing of Wilma Chan, who was my role model, with a very profound sense of responsibility and determination to improve county services for working families, and also serve as the bilingual voice for our large and our growing immigrant population. I will prioritize the issues of housing, community safety, and healthcare, especially mental health care access, and bring my lived experience as a daughter of immigrant parents who relied on county bilingual healthcare as your next supervisor. I live and I grew up in Alameda, going through the public school system here, graduating from UC Berkeley in environmental engineering and public administration. I work in Oakland Chinatown for the last 30 years at the East Bay Mud Building, and I have a proven track record of collaboration in giving a voice to our multicultural community. As vice mayor of the city of Alameda, I work to get affordable housing built for our low-income seniors, the disabled, veterans, and converted an old hotel into workforce housing. As president of the Alameda Healthcare District Board governing Alameda Hospital, we established an infusion center to improve access to cancer treatment and consolidated services for a women's health center so they have safe reproductive choices in care. When I chaired the Alameda County Planning Commission, we entitled 2,400 new housing units near transit, and I plan on implementing a lot of the programs to improve housing in our county. I would be honored to earn your vote to advocate for the needs of our community and continue learning from all of you in expanding core county services. Thank you.
Thank you, Lena. Let's talk a little bit about the challenges in Alameda. I'm sure you've thought a lot about this. Rebecca, what do you think the current healthcare challenges are in Alameda? And what are some of the steps you will take to address these challenges? And you have more than 2 minutes to do this, by the way. It's a combo question.
Well, thank you so much for that. And it is absolutely the essential question. First of all, I want to make clear that our community health centers are absolutely necessary and essential, and I'm fully committed to strengthening them. I also recognize that our hospitals, including our level 1 trauma center at Highland and others, need the community health centers too to exist, to ensure that everybody's needs can be met and that we treat people earlier on before their conditions worsen and get harder to treat. I have actively fought for the needs of our community health centers even now as an Oakland City Council member, and would have a lot more resources and leverage to do so as county supervisor. That includes adequate funding so that our health centers can fully pay the staff they need at the rates they need to pay to attract and retain the workforce. Even now in the city of Oakland, I have advanced a proposal together with my colleague, Councilmember Noel Gallo, to authorize the direct funding of our nonprofit community health centers through a city program involving revenue from advertising. I have also worked directly using the Oakland Recovery Funds to fund community health efforts, and even while not currently on the county board, have successfully pressured the state and federal government to allocate vaccines to our region, and helped launch the largest COVID vaccination program in the nation at the time. And while it was headquartered at the Coliseum, it was actually our community-based health centers that really stepped up as participants in that vaccination and getting out to underserved communities. And we pushed both Cal OES, FEMA, and collaborated with county health to help make that happen. Of course, as county supervisor, I would have control over a much larger budget, have access to some of the additional state funding, and control publicly owned land, all of which can be leveraged to support our community-based health centers. I also want to acknowledge that besides funding, another major crisis is staffing, and that the workforce shortage is a significant crisis and will only get worse in the years ahead if we don't take significant action to fix it. Our population is aging. The proportion of people with disabilities and other health conditions that require ongoing care is increasing, and the workforce is shrinking. People are retiring, people are leaving, people are getting burnt out, and people are leaving our region because they can't afford to live here. I would take immediate action to fund on a direct, immediate basis, a workforce training and paid student loan program where the county would front the money for local residents who would represent all of our cultural communities and have the language and the skills to pay for their schooling and their training to get the certifications and licenses in the various fields, including mental health, nursing, and others where we have these shortages, so that we are directly investing in building up our own future workforce to serve these essential frontline needs. And I see that's time, so I'll tell you more later. Thank you so much.
Thank you. Lena, the challenges and the steps that you would take to address.
This is similar to what I have seen with the late Supervisor Wilma Chan's vision of trying to eradicate poverty. Many of the low-income residents and people of color in Alameda County face barriers to good health, such as poor air quality, dilapidated housing, limited access to healthy foods and parks, and very few economic opportunities. And these community conditions are linked to higher rates of like asthma attacks, obesity, diabetes, heart disease, and mortality. In some recent conversations I've had with Dr. Donna Carey, a Black person born in West Oakland can expect to die almost 15 years earlier than a white child born in the Oakland Hills of California. So in order to foster greater health equity, which is one of the most significant challenges we face in the county, I will work to ensure a strong county government and community partnership to expand and locate navigation centers to address housing and food insecurity, devote staff to strengthen ties with other governmental sectors and community groups in coordinating the various mental health care initiatives that we are going to be seeing coming through from the surplus that we are expecting from the state government, working with the community partners to expand access to care and improving health quality and outcomes by streamlining enrollment into Medi-Cal, Covered California, and other coverage, and also using dynamic data to identify the social and health inequities that we're seeing at the neighborhood level to increase specific access to disease prevention, whether it's food insecurity, food as medicine, and early detection programs like having mobile care units at schools with dental programs. And so these are the things that I think will help move us toward addressing these challenges. Thank you. Oh, I have more time. Sorry. That's okay. I'll listen more and
good?
talk less.
Okay, no. You're up next. We're going to switch order for this next question for you. Since their inception, our health centers have been mission driven to provide comprehensive care to our most vulnerable community members by reducing barriers through culturally and linguistic care delivery systems. You participated in our first candidates forum in May and had the opportunity to learn more about our community health center network and our role in the county. If elected, how will you work with community health centers to ensure healthcare needs of Alameda County residents are met?
So in my elected office and appointed office, I have a history of being highly consultative because I had basically chaired the Alameda County League of Women Voters, both at the city and county level, and know that collaborations with community partners is essential to getting anything done. And certainly it's going to be essential to one of my priorities of increasing community healthcare centers capacity that would integrate primary care and behavioral health care. And this includes integrating the community partners into the decision-making process through the advisory boards and commissions. For example, we all know that there's a staffing shortage, a very significant one in the mental health care field with the retirements and with burnout. Yet we've already seen that we can expect an increasing need for these services through programs like Macro in Oakland or CARE in Alameda, essentially an increasing number of referrals from mobile crisis interventions or support from hospitals or emergency departments that have to work through referring people that are coming through their departments to mental health care. And this can be done by working within our healthcare system to offer more competitive salaries, intensive in-person training, sponsorships through student loan programs, webinars, organizing and fostering forums within our communities on problem solving, exchanging best practices ideas, and then certainly strengthening the partnerships that we need within the county with our psychiatric and our hospital services.
Thank you. Rebecca?
Absolutely. Well, it is such a great pleasure to be connecting with you again. And one of the things that I would immediately seek to do if I have the honor to be elected supervisor would be to set up regular standing meetings with the consortium, because I think it is really important that the ideas and the plans move forward together and with that ongoing feedback loop, and also to make sure we're checking in on things before a crisis blows up so that we can avert them. And that includes working through the issue of the county budget, the county allocations of the additional assistive funds, the county allocations of new ballot measure money and new state money that the county is able to access, and to make sure that we're using that in a way that supports our community health centers. That also means with the job training program I'm talking about, that the people who would be funded to get trained would not only be able to work in the county hospitals like Highland and San Leandro and Alameda, they would also be able to work in our community health centers and not have to pay back those loans if they did that. That would be included as a community work that would give them that access to that free training. I also think it's essential to make sure that we are being creative with bringing in the funding to support the community health centers and to recognize that these are good investments. That's one of the things that I bring to the table, is I have a strong track record bringing in outside money, including tens of millions of dollars for Macro from the state in Oakland. And most recently, as we talk about some of the horrific diesel particulate emissions that causes that life expectancy differential that is so horrible on so many of our communities, I won over $30 million in outside grants to launch what will be the nation's leading zero emission truck program in partnership with Alameda County and the Port of Oakland to help clean up the air. Those are just some examples, and there is a lot more out there that we can bring to support our health centers. Thank you.
Thank you so much. Rebecca, I'm going to turn it back over to you. And both of you have mentioned a lot about justice and equity, and we are your comrades and your partners in that. the late Supervisor Wilma Chan was a legacy leader and a champion for community health centers, immigrant rights, children's health care, equitable access, eradicating social determinants of health, and just a general overall leader for social justice. So health centers are a part of that movement as well, and we fight very hard for access for everybody. How will you help us and help our community partners expand access to comprehensive, equitable healthcare, not just for medical, but also dental? We've talked about behavioral health to our most vulnerable county residents. We serve many of them, but we haven't been able to hit every single part. There's still grave disparities, as you've noted, in life expectancy. What more can we do to reach our most vulnerable patients?
Absolutely. Thank you so much. No, and it's incredibly important that we uplift the commitment to health and to health justice of Supervisor Wilma Chan, both in name and in action. And so in terms of honoring her life and her commitment, I have already, together with two of my colleagues on the Oakland City Council, successfully brought forward an action to rename a major park in Oakland, Wilma Chan Park, and to set aside funding for putting in programming and information there to honor and uplift her legacy. And I would seek to expand on that, bringing more services and programs into the park, as we have already begun to do, to make sure that it is activated, that it is a living monument. I also think it's important to recognize that as someone who seeks to be in the job of supervisor, that my obligation would be not only to uplift her name and her memory, but also her actual literal work, the tangible projects that Supervisor Wilma Chan was working on. And that includes things like access to healthy food. And I have already partnered closely with the All In Eats and the Food Hub program and identified a new funding source that they didn't previously have access to pay for healthy food delivery to community members who can't get out and who can't get to the program. And I've successfully passed that funding. And so similarly, with access to healthcare, we need to reduce the paperwork and bureaucratic barriers to people signing up. We need to fund our community health centers to provide that treatment, whether or not the participants have signed up for any particular program. We need to provide those services in both outdoor locations as well as traditional locations, and fund our health centers to be in places like parks and plazas, serving people who might otherwise not see it or think about it to come in, like what we did with the vaccination sites. And I see that's time. Thank you.
Thank you, Rebecca. Lena?
So the access to quality and comprehensive healthcare should not be tied to your zip code or your immigration status. That's very clear. And what we've seen is that low income and vulnerable communities are adversely affected by trauma and poverty, and they should be offered access to culturally and linguistically aligned mental health care services in their neighborhoods. What we found, like during the pandemic, the data clearly showed that the majority of immigrants in the country, 69%, were essential workers, but they were disproportionately had access to medical services. And that is something that we need to address in order to fully recover from the pandemic. And we need to ensure that they have equal access to vaccines, testing, and medication. So COVID has brought to light a lot of the vulnerabilities and the challenges that we've had in delivering healthcare services, whether it's staffing, distribution of protective equipment, burnout of healthcare workers. So I want to expand on the legacy of the late Wilma Chan to help this most vulnerable part by everything from reimagining our emergency medical system, our EMS system, to responding to mental health crises, providing mobile clinics to schools, vaccination, dental, and behavioral care. And this would include expanding the navigation centers to help those that are unhoused get the referrals to healthcare and supportive housing. I think community clinics will continue to play a vital role in access to healthcare because positive healthcare outcomes require that we have culturally and linguistically competent healthcare professionals in our community.
Thank you so much. We're going to shift this question a little bit more to civic engagement, because for the network and for our health center, civic engagement is about power, it's about community health. I'm curious your thoughts. So civic engagement is a part of who we are. It's very important. We're active in strengthening health center advocacy capacity and empowering health center staff and patients to learn more about policies that directly impact their access to healthcare. Do you have a plan to continue to empower community members through increased civic engagement? And if so, how?
Am I starting?
Oh, that's sorry. Yes, I'm going to have Lena share that. Lena share that one. Sorry about that.
Just double checking. So having served as the past president of the Alameda County League of Women Voters, I have promoted the informed and active participations of citizens in their government, and I continue to advocate through the league and through a number of other coalitions for programs like universal health care, which we will get there at some point. And in Alameda, I've been a part of this coalition advocating for a wellness center that provides homeless seniors that are discharged from the hospital with managed care and also provide compassionate hospice care. And so I also take care of my aging parents who need bilingual assistance and understand the importance of having a healthcare advocate when it comes to diagnosis and treatment. So bringing this lived experience and advocacy experience and learning from the pandemic, I would facilitate the advocacy that the consortium had outlined on their priority issues by convening experts to advise on the allocation of resources, whether it comes to improving telehealth care services, which we found was critical during the pandemic, looking at ways to expand relief and recovery from COVID, particularly for communities of color, expanding mental health care responses like macro and care to the county sheriff's office to be able to move individuals experiencing mental health crisis to community intervention, and also making sure that they have the ability to pay for that service so that these facilities can get the reimbursement through Medicare and to have those types of safeguards in place. So those are the programs that I would like to see and convene an effort in moving the advocacy of the consortium forward.
Thank you, Lena. Rebecca?
Thank you so much. My deep commitment to community engagement includes being ready and willing and eager to have regular ongoing meetings where we plan and strategize together, but it goes beyond that. It also means being willing and excited to bring forward ideas that come from the community. So it isn't just us meeting about, oh, here's something I, as the government official, want to do, but in fact, learning from the community, letting the community lead, and being willing to fight for community needs that come from that engagement. So let me share an example. This is something I actually worked on together with Supervisor Wilma Chan, was the passage of a ballot measure in Oakland that created a tax on sugar sweetened beverages, commonly known as the soda tax, and the money from that tax goes to fund health and nutrition programs in the community. Now, that idea came from a group of community health advocates who had gotten together, and then they approached some members of the council to say, will you carry forward this idea? And not everybody was excited to carry forward someone else's idea, but I stepped up along with a colleague co-author, and Supervisor Wilma Chan from the county worked on it as well. And we faced down millions of dollars of sleazy lies that tried to defeat it, but we won, and we created a whole new ongoing funding stream for health and nutrition programs. And so that's the level and depth of community engagement that I'm committed to. I worked similarly with community to create the macro civilian crisis responder program and to navigate the politics of getting that passed and getting it funded. And I would be honored to do that level of work with all of you. Thank you.
Thank you. Thank you. We've reached the end of our written questions, and we will have just a couple more. If anyone has questions in the forum, please feel free to type them in. One question that I'm sure you get in every single candidates forum that you have is about cost of living and housing and Alameda being so expensive. What are your thoughts about tackling this pervasive, almost intractable issue that you would share with us today? Lena?
So the county provides essentially the social services, the programs, the case managers, and the navigation services. The cities provide the land use and the economic development. That's basically the major roles. And for the county, we take on that role in the unincorporated areas, the 140,000 people that live in Castro Valley, San Lorenzo. And so what I have would like to see, and what I have done when I was on the County Planning Commission, is to basically metrics that would increase the different housing stocks, and not only just affordable housing. And obviously, when I was at the city of Alameda, we were able to utilize land after securing funding from cleaning up the Naval Air Station to build housing for veterans, and using land that was federally owned, governmentally owned, and was turned over to the city. We were able to put in recently 50 units of housing that would be supportive and transitional housing, and that is something that is going to be terribly needed. And it's also not just housing for one sector. In order to basically bring down the cost of housing, we need to address the housing shortage overall at the county. The studies from the Home Together plan has shown that we're going to need about 24,000 additional housing opportunities in the next 5 years to meet just the needs of people experiencing homelessness. And we've only built like 3,200. So we have to find ways to streamline that process, work with the state in enforcing a lot of the programs that have been put in place to help with permitting, and also capitalizing on the best and highest use of basically like parking lots, turning that into housing that is available for all.
Thank you so much, Lena. Rebecca?
Yes, the lack of affordable housing for our community is causing all kinds of different problems. The lack of affordable housing is the major contributor to the skyrocketing homelessness. And on top of that, the lack of housing that is affordable to our workforce is causing a worsening of the worker shortage. We can't keep nurses and teachers because they can't find housing here. So we need to significantly expand the number of housing units that we are building, including those that we are setting aside for workforce housing, as well as for very low and no income. And so how do we make sure this actually happens? One of our strongest pieces of leverage that we can use and need to use, and which I have fought for us to use at the city, is public land to develop affordable housing. Affordable housing organizations these days, if they have to compete with the private market to buy commercially available land, they get priced out. But the city owns a lot of land, and the county owns even more land. And those create opportunities for us to leverage that to win state grants that we can win based on the value of that local land, and to use that land to let the affordable housing developers not have the land purchase price and be able to focus on building housing, and put in requirements to prioritize local essential workers and include workforce housing. For example, the Coliseum property, co-owned by the city and the county, I successfully got the city council to approve a plan for that site that includes 3,000 units of new housing, with a third set aside as affordable and workforce housing. We are advocating for that to be done at the police administration building at 7th and Broadway, that's going to be relocated with a new building, that site will be available for housing. We've set aside the city garage, and we have more properties we can push for. The county has something else to use also. The county every year sells hundreds of houses through the tax auction process, and needs to give those priority for housing for our workforce and as affordable housing. And we also need to provide home buyer assistance for our workforce so they can participate as well. Oh, sorry, I see that popped up. Thank you.
Huge problems. Thank you both for that answer. What are you, we'll give you a softball. What are you, if you were elected, what are you most excited about, and what do you plan on doing in your first 90 days? How about Rebecca?
So in my first 90 days, I will launch the job recruitment and training program so that we can fund people to get the training and skills for our essential frontline workers where the shortages are causing such problems. I also would significantly expand our homeless response and coordination. There are some dorms and hotels that are available now where we could get people off the streets right away into a building where we would also have services and support on site, like what we've done with Lau Family Community Development at the former Motel 6, and what we're doing right now at the Lake Merritt Lodge in Oakland as well. We need to be doing dorms and hotels throughout the community, as well as providing managed RV parks with sewage and sanitation, where people have, responsibilities and clarity and a space they can park with utilities and without trash and sewage running through our streets. So I would launch those immediately. In addition, the Oakland City Council has formally requested a joint city-county effort on homelessness. That letter was sent by Council President Nikki BoS to the Board of Supervisors. They have not yet undertaken that request. And as supervisor, I would immediately follow up on that request and launch that joint city-county effort. Part of the reason the homeless response is inadequate is because while most of the money flows through the county, some of it also goes through the cities, and the lack of sufficient coordination means homeless people are told to call like 20 different phone numbers to get set up with a place to go. And so that would also be something that I would work to launch immediately. In addition, I believe it is essential that we have better regional coordination on public safety. We have a lot of criminal enterprises, including illegal gun dealers, who are crossing multiple city lines. And so we need our countywide resources to work with our city to track down and put out of business the illegal gun dealers who are profiting by selling death into our community. And I would work with our community health centers to fund expansion of active outreach, to make sure they have enough money to recruit and retain the needed workforce, and to fund the having of vaccine and testing sites readily available for people without excessive paperwork, and not only for COVID, but for the many things for which people now need to get vaccinated urgently. Thank you.
Thank you, Rebecca. Lena?
In the first 90 days, I would work very closely with my colleagues to make sure that Alameda County gets a significant share of the $12 billion that's earmarked for mental health care, including some of the care court programs, because that is something that will be a challenge for our county to implement, particularly in making sure that we have greater coordination over mental health care programs. And the other part that I will work aggressively with my colleagues and also the administration is to secure part of the $10 billion that's allocated for homelessness. And also, one of the programs that could not secure funding in the last round with Home Key was the navigation center in the city of San Leandro, that it's right near a homeless encampment. It's a hotel, a 31-unit hotel that could certainly use the funding to address the needs in that part of the county. So those are the things that I would like to pursue aggressively. And obviously, the one aspect that I want to work very closely with the newly elected sheriff is to look at expanding programs like Macro and like CARE into the county, where we can provide the kind of response that's appropriate 24/7 for people that are mentally ill, whether they're homeless or not, and to make sure that we have the professional resources to respond to those kind of mental health crises.
Thank you so much. In this time that we've been talking, an audience member has written in a question. How can, and we'll start Lena with you on this one, how can you improve accountability of how underhoused funds are being distributed?
So the city of Oakland recently had their second audit to look at how the $69 million that was allocated to Oakland from the state and federal government were used over a 3-year period. And one of the main things that was lacking was the accountability of whether or not the funds met its intended goal of placing people in permanent housing. And this is something that I think the county can help, particularly with its homeless information system, and ensuring that we have the right resources going not just to the city of Oakland, but throughout the county, in having that consolidated data that would be needed, because that is the justification for funding in the following year with a lot of the basically the community-based organizations, whether it's the Lau family and different navigation centers that we have within the city of Alameda, and hopefully the one we'll see in San Leandro, and several of them. And having that accountability through tracking and having that information will be very significant in making sure that we know that the funds are being used appropriately.
Yes, thank you very much. So the auditor's report identified a couple of main points that need to be dealt with that relate to the question of how we are tracking the homelessness funding. One of the main points in the audit report was that the county data systems were not up to date and did not have the information inputted in a consistent way that allowed them to identify where people had ended up and whether people had been rehoused or not. So while it was the Oakland auditor who wrote the report, it was actually the Alameda County data system that she's describing in the report, where she says that the HMIS system, that's the county HMIS system, as she says in her report, was not tracking the data in a consistent way. So that doesn't mean they said that everybody wasn't actually rehoused. It said that they weren't able to sufficiently identify who was and who wasn't, and that the data wasn't being tracked consistently. So that is something absolutely, as county supervisor, I would push hard for the county to fix immediately. That is a major problem. And that also relates to why I said we would need to launch that city-county collaborative that the city of Oakland has already requested and that we need the county to respond to. But there's another piece to that. Besides doing a better job with the data tracking, we need to have the political courage to be willing to admit what is working and what is not working, and to fight to expand the programs that are working. The use of the tool sheds has not been successful. Many of those programs are not successfully getting people rehoused. The types of programs that have been found to be more successful are the ones where people are typically in a facility where they get both a room, and there are also on-site staff and support services, getting people driver's licenses, getting people access to bank accounts, jobs programs, like what we're doing with the Lake Merritt Lodge and some of the converted hotels. And so we need to do both tracking of the data and then invest in the efforts that work. For better or for worse, there are multiple hotel owners now ready to sell, and we have an opportunity to bring these efforts to scale and get people off the streets into rooms with electricity and running water, and have them have support services on site to rebuild their lives.
Thank you for that. We're going to move to our closing statements, and then Aphomia will do a slide on voting to encourage everyone to get out and vote, and then we will end our candidates forum. So we'll turn it, Rebecca, if you could start with you for the closing statement, please.
Thank you very much. And it's been a great honor to be back here with all of you again. And I hope that we have the opportunity to continue to meet and work together. I would be very honored to be your county supervisor and to fight for healthcare access and justice and housing for all of our community. There are tools and resources that the county holds and can leverage to fund our healthcare services, to fund affordable housing, to fund the needs of our workforce, and I'm committed to making those available. I'm incredibly honored to be endorsed by the Democratic Party, Planned Parenthood advocates Marmonte, our nurses, our firefighters, and community leaders like Sandre Swanson, Bill Quirk, and Ellen Corbett, and many others. I would be very honored to have your vote, and for us to work together to build a stronger and healthier future for our county. Thank you so much. It's an honor to be with you.
Thank you, Rebecca. Lena?
Thank you again for hosting this forum. I want to work with you to be your voice on the Board of Supervisors. I bring the depth and the breadth of experience and leadership skills to the board, having served on the City Council, the Healthcare District Board, and the Alameda County Planning Commission. As the past president of the Alameda Healthcare District Board, I view my priority issues of addressing community safety, homelessness, and mental health care access through essentially a public health lens. As your supervisor, I will take on the responsibility and the challenge of addressing the social determinants of health, housing and food insecurity, early childhood care, increasing access both physically and financially to healthcare. Since the primary election, I've had a number of conversations with experts in our community and actively listened to find ways to reverse the disparities that we're seeing in our community, where homelessness shortens lifespans with a lack of mental health care, where maternal deaths are higher, 2 to 4 times higher among Black women, and Black infants are 2 to 3 times more likely to die within the first year of life. This also means addressing the systemic racism we're seeing in our healthcare system by providing continued support for our neighborhood community clinics and helping local organizations to set up clinics at churches, recreation, or navigation centers. Expanding on the legacy of the late Wilma Chan and my past service, I would be honored to earn your vote to advocate for safety and programs that protect the most vulnerable. I am honored to have the support of all 3 mayors, other supervisorial candidates like David Kakashiba, along with elected officials like Supervisor Brown and David Halpert, the East Bay Times, the Alameda Contra Costa Medical Association, and others listed at lenatam.com. Thank you for your time.
Thank you. And I'd like to thank the candidates for joining us this afternoon. We are so honored to have you and for participating in our forum today and sharing your priorities and your vision. I'd like to give a special thanks to the staff at the Alameda Health Consortium who helped make this forum happen and bringing our clinic members together. A recording of this discussion will be uploaded to the Alameda Health Consortium YouTube channel. The link was just shared with you in the chat, and you are welcome to share that with your colleagues and other community members. And I'll now turn it over to Aphomia to provide important voting reminders and a closing statement. Thank you.
Thank you. I hope you found this conversation really helpful. And as a reminder, we have some important dates that we just want to share with you all, as folks probably have already received voter information. Go ahead and take a moment to look at kind of the process and really get a sense of, how to participate. 3 important dates to just watch out for is October 24th. If you are not a registered individual, this is the last day to register. However, if you don't go through that process, know that you could do same-day registration all the way to Election Day. And as you probably already know, November 8th is Election Day. So we highly encourage all of you to register, get out and vote. So we want to take this moment to also thank you and saying thank you so much for participating, getting to know our candidates, and also to our candidates, thank you for coming back and having this conversation with us. We hope this has inspired all of you to participate in more of these civic engagement activities. Have a great afternoon and have a great day. Thank you, everyone.